Act 1. The call. You're 3 whiskeys into a Friday night when your phone rings. The hospital. Level 1 trauma. Gunshot wound to the abdomen. You tell them you're on your way. You haven't operated in 6 days. Your hands need the work. The drive takes 11 minutes. You run every red light. You don't know the patient's name yet. You don't know his face. You park crooked and walk through the ER doors like you've done 1,000 times. The fluorescent lights hit you. The smell of iodine. The hum of machines. This is where you become someone else. Not a father, not a widower, just a surgeon. Act 2. The prep. The trauma team briefs you in the hallway. Male, mid-40s, single GSW to the upper left abdomen. Possible splenic laceration. BP dropping. Pulse thready. You scrub in. Water at 104 degrees. Betadine up to the elbows. The ritual calms you. It always has. Your resident, Dr. Okafor, reads the chart beside you. She's good, steady hands, doesn't talk too much. The anesthesiologist, Dr. Pratt, signals he's ready. You push through the double doors into OR 3. The patient is draped, intubated, monitors beeping. You haven't seen his face yet. You step up to the table and ask for a 10-blade. This is routine. You've done this 200 times. Act 3. The face. The circulating nurse adjusts the drape near his head, and you see him. Your hands stop mid-air. You know that face. You've seen it in courtroom sketches, in police photographs, in your nightmares. That jawline. That scar above the left eyebrow. Daniel Mercer. The man who killed your wife. He was drunk. She was walking home from the bookstore. He fled. They caught him 4 days later. He got 7 years. He served 4, and now he's bleeding out on your table. Your hands are shaking. The 10-blade feels like it weighs 40 pounds. Dr. Okafor looks at you. She doesn't know. Nobody in this room knows. Act 4. The oath. Your mind splits in two. One half says, walk away. Let someone else do this. The other half says there is no one else. Not tonight. Dr. Pratt calls out the vitals. BP 80/50, dropping. You have maybe 6 minutes before he bleeds out. If you leave this room, he dies. If you stay, you save the man who took everything from you. You think about Claire, her laugh, the way she folded towels in thirds, the way the officer said the words and your knees gave out. You close your eyes for exactly 2 seconds. When you open them, you're not a husband anymore. You're a surgeon. You say incision, and the blade touches skin. Act 5. The operation. You cut through the fascia. Blood pools immediately. The spleen is shattered. Grade 4 laceration. You call for suction. Dr. Okafor retracts. Clamp. Tie. Cauterize. Repeat. You find the splenic artery and isolate it. The bleeding slows. Not enough. There's a second bleeder. Deep. Near the pancreatic tail. You ask for a longer clamp. Your voice is calm. Your pulse is not. The monitor screams. His heart rate drops to 42. Dr. Pratt pushes atropine. You keep cutting. You find the bleeder, a torn branch of the left gastric artery. You clamp it, tie it. The bleeding stops. For the first time in 40 minutes, the room is quiet. You perform a full splenectomy. Textbook. Clean. You close him layer by layer. Fascia. Subcutaneous. Skin. The last suture goes in at 1:47 a.m. Daniel Mercer is alive because of you. Act 6. The hallway. You strip your gloves off and drop them in the bin. Your hands are still shaking. Not from the surgery. You walk into the scrub room and lean over the sink. The water runs, but you don't wash. You just stand there, breathing. Dr. Okafor comes in. She says it was a clean save. You nod. You can't speak. She leaves. You're alone. You look at your hands. These hands just saved the man who destroyed your life. The same hands that held Claire's, that carried her coffin. You punch the tile wall once, then twice. Your knuckle splits open, but you don't feel it. You wrap it with gauze and walk to the break room. The coffee is cold. You drink it anyway. Act 7. The visit. 26 hours later, Daniel Mercer wakes up. You're not required to visit post-op patients personally, but you go anyway. You don't know why. You stand at the door of room 412 and watch him breathe. He looks smaller than you imagined, thinner, older. Prison aged him 20 years and 4. His eyes open. He looks at you. He doesn't recognize you. Why would he? He says, "Are you my doctor?" You say, "I'm your surgeon. I removed your spleen last night." He says, "Thank you." 2 words. The same mouth that never apologized to you, that never showed remorse in court. He says thank you, and you feel absolutely nothing. That terrifies you more than the anger ever did. Act 8. The truth. 3 days later, a nurse tells Mercer who you are. She didn't mean to. She recognized the name from the news. You get a call from the chief of surgery. He asks if you knew. You say yes. He asks why you didn't recuse yourself. You say because he would have died. The chief is quiet for a long time. He says the board might review this. You say, let them. There is no rule that says a surgeon must love his patient. There is only a rule that says a surgeon must save him. You followed the only rule that matters. Act 9. The letter. 1 week later, a handwritten letter arrives at the hospital. It's from Daniel Mercer. You hold it for 3 hours before you open it. The handwriting is shaky, barely legible. It says he didn't know who you were until the nurse told him. It says he hasn't slept since. It says he thinks about your wife every single day. It says he's sorry, that he was a coward for never saying it before. It says he doesn't expect forgiveness. It says he knows he doesn't deserve to be alive. It says the fact that you saved him anyway is the worst punishment he's ever received, because now he has to live knowing what kind of man you are and what kind of man he is. You read it twice. Then you fold it and put it in your coat pocket. You carry it for 6 months before you throw it away. Act 10. The after. The board clears you. No violation, no misconduct. Your colleagues call you a hero. You hate the word. You didn't save Daniel Mercer because you're good. You saved him because that's what your hands were trained to do. You go back to work the next Monday. Same scrubs, same routine. Every patient on your table is just a body. You don't check names anymore. You don't want to know. Claire would have told you that's not healthy. Claire would have been right. You operate on 14 more patients that month. You save 13. You don't cry. You haven't cried since the funeral. But that night, you sit in the parking lot for 2 hours. Engine off, lights off, just sitting in the silence that your life has become. The oath says, do no harm. It doesn't say anything about what the doing does to you.